in the well-being, safety and dignity of trans people of all ages. And this government will work with them to help them live freely, equally and with the dignity that everyone in our country deserves. And I commend this statement to the House.
Shadow Secretary of State Ed Arder.
Thank you, Madam Deputy Speaker, and I thank the Secretary of State for advance side of his statement and also for his courtesy in coming to this House for an oral statement to give honourable members the opportunity to ask questions of him. When the Secretary of State is wrong, we will challenge him robustly and hold him to account, but when he is right, we will support him. That is responsible opposition. In what he sets out today, he is right and he has my support in what he is doing. Protecting children is one of the most important priorities that a Health Secretary can have. My predecessor, the Right Honourable Member for Louth and Horncastle, worked tirelessly to do just this, setting out that it was her priority to protect children and young people from the risks to their safety of the prescription of puberty blockers given the lack of an evidence base. I welcome the Secretary of State, that the Secretary of State is continuing with the work that was started under the previous government and for his support for that at the time and all that he has done since, including in his statement on the 4th of September. I would also associate myself with the three principles he enunciated when he opened his statement. With increasing numbers of young people questioning their gender identity, NHS England, with the support of previous Conservative Health Secretaries Matt Hancock and Sir Sajid Javid, commissioned Dr Hilary Cass to examine the state of services for children questioning their gender. Now, that historic review was able to cut through the noise and ideology to lay bare the clear facts so that we as policymakers can seek to make decisions based on evidence, safety and biological reality and create a service that better serves the needs of children, as the Secretary of State set out. In the review, Dr Cass made it clear that not enough is known about the lifelong impact of using puberty blockers on young minds and bodies to be clear that they are safe, and that the robust evidence base was simply not there. So in March, NHS England made the landmark decision to end the routine prescription to children of puberty blockers for gender dysphoria. With the support of the then government, it announced it was stopping children under 18 from being seen by adult gender services with immediate effect. And as one of the final acts of the previous government, my right honourable friend, the former Secretary of State, used emergency powers under Section 62 of the Medicines Act 1968 to extend the ban to private clinics selling puberty blockers to young people questioning their gender. It was the right thing to do. I agree with her and pay tribute to her, as equally I do to him today for what he has done subsequently. The safety and well-being of children and young people must come above any other concern. And I welcome that today the Secretary of State, but previously the Secretary of State renewed the order, and in today's statement he makes it an indefinite ban, given the absence at present of an evidence base around this, and seeks in his statement to better understand that evidence base and to build that evidence base. I have a few questions which I hope he can offer clarifications on in a constructive spirit. I hope, and I think he in his final remarks in his statement alluded to this, that the Secretary of State can confirm that he intends to implement the Cass Review's recommendations in full. Now, of course, support must be available to children and young people who are questioning their gender identity, and that support must be holistic, multidisciplinary and evidence-led. After the Tavistock Clinic was closed earlier this year, as he set out, 3 new regional NHS children and young people's gender services have opened to provide better, tailored gender services for children and young people, again based on recommendations in the Cass Review. Is the Secretary of State able to provide a little more detail on the trajectory of the delivery of those remaining regional centres and potentially the order in which they're due to open in the coming year, so that children and families will be able to see what is happening in their own region, again putting the best interests of those young people at heart? Is he able to offer the House reassurances that these measures will be UK-wide and that he is working in tandem with the devolved administrations on these issues? Will he advise a little further on what progress has been made thus far, and I appreciate it's early days, on further research into patient care and increasing that evidence base? And can he also offer an update to the House on the steps taken to continue the work of his predecessor when she announced this in May to the House, to work to close any potential online loopholes to the regulations he's put in place? And finally, would he, and I suspect I know the answer to this one, will he commit to keeping the House updated in the months and the years ahead on developments in this space? Madam Deputy Speaker, our children and young people deserve healthcare that is compassionate, caring and careful and led by evidence. I want to associate myself with his concluding remarks in respect to the need for this debate to be conducted in a respectful and very sensitive way, with the needs of children and young people at its heart. We will support measures and support him in bringing forward measures that protect children, and we want to work constructively with the government to give the next generation access to the right healthcare to meet their needs. I look forward to working with him in the months ahead.
Firstly, can I thank the Shadow Secretary of State for the constructive way in which he has responded to this statement and the tone with which he has approached this issue. I think it's worth everyone bearing in mind that statements in this House and indeed online, every word is often hung upon by a particularly vulnerable group of children and young people. And many of them feel very afraid about the environment in which they are growing up, and so do their families. So to establish an environment in which we can discuss issues with their welfare and their well-being at heart is the right way to approach these sorts of issues. And I've said many times before, and I'm sure the Shadow Secretary of State would agree, we need less heat and more light, and we can show that leadership together in trying to provide that climate. I am absolutely committed to the full implementation of the CAS review. He asked about the implementation of new children and young people's services on gender incongruence. As I said, North West London and Bristol are now open. The fourth service is planned in the east of England for spring of next year. We want a specialist gender service in every region by 2026, and of course I'll keep him and the House updated on that. I'm also working closely with my counterparts in the devolved governments, and I particularly welcome the engagement I've had with my counterpart in Northern Ireland and his predecessor, who is within my line of sight on this issue. I really do appreciate the way in which we've been able to work together on this and many other issues. He asked about loopholes. I will keep this under close observation and review, and it is worth pointing out that in terms of sanctions, penalties and enforcement, breach of this order is a criminal offence under the Medicines Act 1968. It is a criminal offence to supply these medicines outside the terms of the order. That means pharmacists who dispense medicines against prescriptions that are not valid may be liable to criminal prosecution. It is a criminal offence to possess these medicines where the individual had reasonable cause to know the medicine had been sold or supplied in breach of the terms of the order. And there are fines and penalties associated with this, including on a case-by-case regulatory enforcement by the General Pharmaceutical Council. So I think we have approached this in an evidence-based way, in a considered way, and with the welfare and interests of children and young people at the heart of our decision-making. And I urge everyone else involved in the provision of health and care to do the same.
Sonia Antoniazzi.
Thank you, Madam Deputy Speaker. I'd like to thank the Health Secretary for his statement today and the manner in which he continues to handle this very important issue. I welcome that the Government is following clinical evidence here, particularly with regard to children and young people whose well-being and protection must be paramount. This is the right approach. Given the CAS review found insufficient evidence to know whether puberty blockers are safe and highlighted their potential harms, there are understandably concerns regarding the risks of trialling them. Can the Secretary of State reassure me that the upcoming trial will have robust safeguards in place and confirm that he will continue to be led by children's well-being and safety?
I can certainly give my honourable friend that assurance. Better quality evidence is critical if the NHS is to provide reliable, transparent information and advice to support children and young people and their parents and carers in making potentially life-changing decisions. That's why we're supporting the setup of the study into the potential benefits and harms of puberty-suppressing hormones as a treatment option. The study team's application for funding is going through all the usual review and approval stages, including peer review and the National Institute for Health and Care Research Funding Committee consideration and full ethical approval processes ahead of setup. We want the trial to begin recruiting participants in spring 2025, but I'm confident in the robust and an appropriate and ethical way in which the trial is being established.
Liberal Democrat spokesperson Helen Morgan.
Thank you very much, Madam Deputy Speaker. Can I start by thanking the Secretary of State for his statement today, not only for obviously the content of his statement, but for its tone and his recognition of the importance of that tone in this place. Because for too long, children and young people who are struggling with their gender identity have been badly let down by a low standard of care, exceptionally long waiting lists, and an increasingly toxic public debate. Before GIDS closed, more than 5,000 young people were stuck on the list for an appointment, left waiting almost 3 years for that first appointment on average. For teenagers going through what is often an incredibly difficult experience, 3 years must feel like an eternity. So change is desperately needed. Liberal Democrats have long pushed to ensure that children and young people can access the high-quality healthcare that they deserve. So we welcome the NHS's move to create multiple new regional centres. But these need to be up and running as quickly as possible now. So can the Secretary of State outline the steps the government's taking to ensure that this happens in every region and also perhaps give us a timetable for it? Tackling the waiting list and improving access to care has got to be a priority. After so many years of being badly let down, I understand why today's news is causing fear and anxiety for some young trans people and their families, and not least those who I've met in my own constituency, who've highlighted the catastrophic mental health impacts of this situation. It's crucial that these sorts of decisions are made by expert clinicians based on the best possible evidence. So will the Secretary of State publish all the evidence behind this decision, including the results of its consultation, to give those families confidence that this is going to be the right move for them? We welcome the announcement of the clinical trial because we need the NHS to build up that evidence base as quickly as possible and for the government to provide certainty that they will follow the evidence and the expert advice on behalf of these children. Thank you.
Mr.
Can I thank the Liberal Democrat spokesperson for the approach she has taken to this. I can certainly respond to the questions she puts. We want all of these regional centres to be up and running by 2026, and we're working with NHS England to achieve that outcome. She mentioned the waiting lists, and to give people a sense of the challenge, the latest figures show 6,237 children and young people on waiting lists for gender services. So we can see even in the length of time that she references that we've seen growth in the waiting list. And as in common with all NHS waiting lists, I want to see those fall. But I think it's particularly important in the context of children and young people services, whether they're gender identity services or other paediatric services, when people or when people are waiting for many years, in some cases that's a school lifetime. And I know for this group of children and young people, time really does feel of the essence. So we owe it to them to get those waiting lists down faster. We are also working to implement the recommendation around the follow-through service for 17 to 25-year-olds. I know there's some anxiety around this issue, and some people have interpreted this as an extension of children's services to 25, and that's really not what we intend at all. It really is about a transitional service from children's services to adult services, and I think that will lead to better care. And finally, I think it's worth pointing out in the context of a statement that focuses particularly on puberty-suppressing hormones. This is not the only treatment for children and young people in this area, and I think there is a danger that the focus on this, because of an inevitable political process and a necessary political process, means that for some children and young people and their families, this is held up as the gold standard treatment, that if they're missing out on it, that they're missing out on any treatment. That's not the case. Indeed, there are many trans people in our country of all ages for whom puberty blockers have never been considered an appropriate intervention. So we've got to see all of the treatment options in the round, and that's why I particularly support the holistic approach to supporting children and young people with gender incongruence that Dr. Cass outlined in her excellent report.
Alex Serval.
Deputy Speaker. I'd first of all like to thank the Secretary of State for addressing the points in my letter to him on this issue, particularly around a holistic approach to the health of trans young people. In his statement, the Secretary of State said that the order would restrict the sale or supply of puberty blockers through a private prescription for under 18s. Can he assure me that this will be for all under 18s and this is not just for those with gender dysphoria? Otherwise, and he well knows this, that this will be used as an attack on trans young people. Is this a universal order and rather than something particularly targeting trans young people?
Madam Deputy Speaker, this order relates to the use of puberty blockers for this particular group of patients for this particular purpose, where the evidence base is not sound and where the Commission on Human Medicines has described the current prescribing environment as representing an unacceptable safety risk. Puberty blockers are safe and proven for use amongst children and young people for other conditions, including precocious puberty. Where we lack a sound evidence base and where we lack a safe prescribing environment and an unacceptable safety risk is in relation to the use of this medicine for this particular purpose, for this particular group of patients.
Rebecca Paul.
Thank you, Madam Deputy Speaker. Can I firstly start by welcoming the Secretary of State's statement and commend the Secretary of State for putting the safety and well-being of children first. The use of puberty blockers to treat gender dysphoria, I'm not going to mince my words, is nothing short of a medical scandal in my view, so I very much welcome the approach that you're taking. You set out in the statement that it's important that young people receive the right care from paediatricians and mental health professionals. Does the Secretary of State agree with me that no child should ever be told by a health professional that they were born in the wrong body?
Madam Deputy Speaker, it's important, particularly with this particular group of children and young people, that clinicians provide holistic healthcare and evidence-led healthcare and ask a range of questions to identify the nature of that particular child's needs and make sure that they respond appropriately with evidence-based healthcare. That is the best way of turning around some of the horrendous statistics we see affecting children and young people with gender dysphoria, and that's how I think we will achieve better, healthier and happier outcomes for this cohort of patients.
Kate Osborne.
Thank you, Madam Deputy Speaker. I wrote to the Secretary of State this morning before this statement was announced, highlighting a report from the Council of Europe that notes that gender-affirming hormone therapy for trans minors in the UK is almost impossible to access, and that the total withdrawal of access to healthcare outside of a research trial may breach the fundamental ethical principles governing research. These restrictions on puberty blockers removes the clinical expertise from medical decision-making and significantly impacts young trans people and their families, and I'm hugely disappointed to hear the contents of this statement today. So can I ask, will the Secretary of State agree to read this report from the Council of Europe and meet with me as a UK delegate to discuss it?
I'm certainly happy to continue meeting with my honourable friend on this issue. I say with great respect to the Council of Europe and the authors of the report that she references, I have to take decisions about the welfare, well-being and safety of children in this country based on clinical evidence. And when our own Commission on Human Medicines says that there is an unacceptable safety risk and an unsafe prescribing environment, I have to take that seriously. When one of our country's leading paediatricians says there is insufficient evidence about the long-term effects of the use of this particular drug for this particular use, for this particular cohort of children and young people, I have to take that seriously. I know there will be people who will be deeply disappointed by this decision. They will include many trans people and their families, and thinking about some of the young people I've met in recent weeks and months, I have taken to heart what they have said. I know this will be deeply upsetting to them. I do not take that lightly, but I would say to anyone challenging me to do something else, to ask quite sincerely, if they were standing in my shoes as the Secretary of State for Health and Social Care, and they were looking at recommendations from clinicians in our country and the Commission including the Commission on Human Medicines, saying there is insufficient evidence for use of medication in children and young people for this purpose, and that there is an unacceptable safety risk arising from the current prescribing environment, I ask them, would they really be taking a different decision?
Jan Burrow.
Mr. Speaker, I'm extremely worried and fearful about this decision to continue this blanket ban, and I want to ask the Minister about his reliance for the terms of reference and reasons for this on the purpose for which these drugs are being prescribed, i.e. being trans, when they are safely used by young people for other conditions, as he acknowledges. Does he understand that this is at heart discriminatory?
I do not agree with the characterisation of the honourable member. There are a whole range of medicines that are prescribed for a whole range of uses among a whole range of patient cohorts, but may well be unsafe or inappropriate or ineffective for use for other patients with other conditions. That is a basic fact of medicine, and if I may say so, her intervention is why we should listen to clinicians, not politicians.
Return.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, I share the deep disappointment that many young trans people and their families will feel about the Health Secretary's decision today. I know that many will be devastated by this news, and I know that they've communicated this to the Health Secretary and his department, their huge concerns that they have about their well-being in the face of these restrictions. Too many young trans people are already in or are at high risk of mental health crisis. What consideration has the Secretary of State given to the impact of this decision on their mental health?
Very heavy consideration. Of all of the considerations, it is the one that has weighed most heavily. As I said in my statement, trans people too often find themselves at the wrong end of statistics when it comes to mental ill health, self-harm and suicide. I take those issues very, very seriously and indeed. What I would say to my honourable friend, members of this House and campaigners, particularly online actors, is that there have been a number of claims made about the data which is not borne out by the facts. And in fact, I asked Professor Lewis Appleby, who is the government's suicide prevention advisor, to examine evidence for some of the claims made. There's been a large rise in suicide. His paper, which was published on the 19th of July, concluded that the data do not support the claim that there have been a large rise in suicide in young gender dysphoria patients at the Tavistock. The way this issue has been discussed on social media has been insensitive, distressing and dangerous, and goes against guidance on safe reporting of suicide. That claims have been placed in the public domain do not meet the basic standards for statistical evidence. That we need to move away from the perception that puberty blocking drugs are the main marker of non-judgmental acceptance in this area of healthcare, and we need to ensure high quality data in which everyone has confidence as the basis of improved safety. I would add that it is also important that we make sure that these children and young people do have access to good quality mental health support. I'm working with NHS England to make sure that this is the case, and I think this area is one that all members should tread carefully when putting into debate.
Sir Julian Lewis.
I don't think anyone who has listened to the Secretary of State today could be in the slightest doubt of the responsibility that he has truly borne and the personal empathy that he has injected into his handling of this very difficult question, and I personally thank him for it. I was told a long time ago one should never ask a question in the House to which one doesn't already know the answer, but I think I'll break the rule this time. What about surgical procedures? One hears about irrevocable steps like so-called top surgery, the removal of healthy breast tissue from young females. Where does the law stand on that issue at the current time?
Well, the only thing worse than the person not knowing the answer to their own question is the Minister not knowing the answer. Happily, in this case, I can say that when it comes to surgical intervention for trans people, that does not apply to children and young people.
To Swallow.
Thank you, Madam Deputy Speaker. I want to welcome the spirit with which the Health Secretary has made the statement today and his commitment to improving healthcare for all trans people. I do want to press him a bit on continuity of care. This summer I had a real struggle working with parents of young trans kids who were supporting their children in their journey and had accessed puberty blockers through some of these overseas prescribers. Now, they had done that after much heartfelt indecision because they thought that they were supporting what was best for their children, and frankly because under the previous government better healthcare options were not available to them. So I really welcome the moves taken to speed up the trial, but I do just want to ask my right honourable friend if he can assure me that whilst we wait for this trial to be set up, nobody currently receiving treatment from puberty blockers, however they may have accessed those in the past, will face a discontinuity in their care.
Grateful to my honourable friend for his question. Any young person in Great Britain and Northern Ireland who had a valid prescription for these medicines in the 6 months prior to 3rd of June and 27th of August respectively can seek continuation of their prescription from a UK registered clinician. Guidance has been issued to general practitioners setting out prescribing scenarios. It remains the case that continuation of puberty-suppressing hormones can be considered where the GP feels competent to do so and where confirmation in the form of documentary evidence that treatment had been underway is available. The guidance also makes clear that GPs should consider what further support should be offered, including assessing whether referral for the Children and Young People's Gender Service or indeed for mental health support is required.
Christine Jardine.
Thank you very much, Madam Deputy Speaker. I would also like to thank the Secretary of State for the empathetic and reassuring approach he has taken today, because this has been a very toxic and in many ways very damaging debate for everyone involved in it. And further to the question about continued care, what reassurances can he give to people who have embarked on a course of treatment that they might now fear will be halted, and the very many young people and their families in this country who are going through a very difficult time, and desperate situations make people do desperate things. What steps is he making to ensure that the availability of these drugs is not driven underground and is available through some means that none of us would like to see?
I'm grateful to the honourable member for her question. As I say, any young person in Great Britain and Northern Ireland who had a valid prescription for these medicines in the 6 months prior to 3rd of June and 27th of August respectively can seek continuation of their prescription from a UK registered clinician. And more broadly, it is my intention to make sure we start bringing down those waiting lists, to make sure that children, young people and their families receive access to the wide range of support, information, advice and guidance that they need to navigate their pathway and to make sure they feel safe, respected and included in discussions about their own healthcare.
Thank
you, Madam Deputy Speaker. The Health Secretary is right when he says that young trans men and young trans women in this country need us all to do better on their behalf, particularly in the debate and particularly in how we move forward, that there must be more light and not heat. He also is right when he says that time is of the essence. I think we can all share with him a concern that all medicines are regulated properly and that we all understand for every patient group the risks and benefits of any medication. But can he give us some more clarity and give those who will be listening to this in fear a sense of where this is going? Because he's talked about an indefinite ban until 2027, not a rolling ban, but an indefinite ban. He's talked about recruiting participants to a study that might begin the recruitment in 2025, but not when the review might begin, when we might get some of the data that he feels is missing and that Dr. Cass identified needed to be provided, so that we can move this debate forward. If time is of the essence and puberty is the matter, we need to give these young people a route map forward.
I'm grateful to my honourable friend for her question. We are trying to proceed at pace with the clinical trial. I share the urgency that my honourable friend brings to her question. I've also had to temper my own urgency with the need to make sure the clinical trial that's established is as robust and ethically sound, if not more ethically sound and robust than any other clinical trial. And the worst thing I could do at this stage, especially when NIHR and NHS England are working at pace to establish a trial, would be to interfere politically in what must be an independent approach. So the planned pathway study, which includes the clinical trial component to build the evidence of the relative benefits of harms of puberty-suppressing hormones, is in the final stages of the commissioning process. Subject to a robust ethical improvements process, the study remains on track to commence recruitment in the spring, and I will issue further updates in early 2025 to keep my honourable friend, the House, and young people and their families informed.
Carla Lockhart.
Deputy Speaker, and I'm sure the Minister or the Secretary of State will welcome the Northern Ireland ban as well, making this a UK-wide ban. Going through puberty is a biological and natural way for a boy or a girl to develop. Anything which interferes with this process in such an extreme way is going against the natural process. Therefore, I agree with the sentiments about it being a scandal that medicine was being given to vulnerable young people without proof of being safe or effective. Can the Secretary of State therefore outline what support is available for those children or young people who have taken these drugs and are bearing the scars of these drugs? And with regards to the clinical trial, once again we see the NHS being used totally contrary to what it's designed for, to protect and preserve life.
I thank the honourable member for her question. In relation to young people who've been on a gender identity pathway and later regret those interventions, whatever those interventions may have been, they are small in number, but they are addressed in the Cass review, and it is important that we don't lose sight of those young adults and older adults who may well need the support of health services if they feel they were inappropriately placed on a gender identity pathway or undertook medical interventions which they have later come to regret, and we keep that and other evidence under close review.
Deputy Speaker, I thank the Secretary of State for his statement, the sensitive way in which he's approached this issue, because nothing is more important than our children and young people's health. A lack of an evidence-based approach may have taken us into a space where there are some young people, children and young people, who have received puberty blockers for whom that is an appropriate intervention, but there may be others who have received that medication for when it wasn't right for them. So can I ask him, or his officials, to look at how we got ourselves into that space? Because there may be lessons there for us to learn, in not just in respect of this issue, but in respect of healthcare more generally, because sometimes when we've rushed into things in the past, we've found something that appears to be a bit of a panacea around an issue. It hasn't turned out to be the right thing at all.
I'm grateful to my honourable friend for his question, and this lies at the heart of the dilemma that has plagued clinical leaders and political leaders, particularly since the scandal at the Tavistock Clinic was brought into public eye. There are many people in our country, young people and actually young and older adults, who will say, and have certainly told me in my office, that having access to puberty-suppressing hormones has been completely life-changing, affirming, and led to a positive outcome for those individuals. And yet, we know that in terms of the prescription of that medication for this particular group of patients for this particular medical need has not been supported by underpinning evidence in the way that other drugs would have been in terms of effective trials and evidence base. And that, I think, has been the challenge. People with lived experience saying this has been positive, but nonetheless, with the Tavistock Clinic in particular, not just puberty blockers, but a whole range of medical interventions being delivered with the best of intentions, but in ways which were inappropriate and clinically unsound. And that was the genesis of the CAS review. That's why I think it's so important that we proceed in an evidence-based way, because to do the contrary risks real harm to people and also a lack of trust in the medical profession, which would be damaging for our entire country and particularly this group of patients.
Joy Morrissey.
And may I thank the Secretary of State for a very nuanced and well thought out and genuine, moving statement. You will very rarely hear me praise the Labour front benches, so enjoy it. And thank you for taking what is a very difficult stance. And what I saw was you put young people first. And you have, and I'm sorry, I'm using the wrong term, but the Secretary of State has protected young people today, and I'm very grateful for that. And I would like to offer my thanks to him. And thank you as well for your nuanced approach, the Secretary of State's nuanced approach in helping trans people in their transition in adulthood, because it is a nuanced approach and it is complicated. And I thank you for understanding that, and I thank you for your boldness today.
Can I thank the honourable member for her intervention? In case she worries she's going soft on the government, or worse still, I worry that I agree with her. We should just remind each other that even a stop clock is right twice a day. And to people watching our proceedings this afternoon, it is true to say that politics in our country has been quite divided on a wide range of issues, certainly in the 9.5 years that I have been in this House. But that is not to say that on a wide range of issues, we either have consensus or we work together to build consensus. I actually think that is a good thing in our politics. There are plenty of things that we can disagree about and divide over in this House and contest elections on, but wherever possible, especially in an area such as this that involves vulnerable children and young people, the more we can try and build consensus and create an environment in our country where these children, young people and their families feel safe, we'll be doing a really good job in doing so. And by far and away the hardest part for me personally in this process has been spending time with these children and young people and their parents, many of whom have spoken in genuine, heartfelt terms about the fear they feel living in our country, some looking to live in other countries and quite sincerely looking, and it breaks my heart actually, because I want this country to be one where everyone, whatever their background, feels safe, included and respected, and there's much we can do across this House to build that kind of country.
Thank you, Madam Deputy Speaker. Can I start by thanking the Secretary of State for his recognition about how difficult this will be for many young trans people and their families to hear the news today, and for his comments about the wider environment in which the trans community is threatened every day in the UK. My significant concern about today's announcement is this will lead to more people getting drugs from unknown sources online without prescription. God knows what is actually in some of those drugs. I also have significant concerns about the access for both young people and older trans people to the services that they need. We know that there's a 6-year waiting list currently, and it's estimated that those joining the list today, if things aren't improved, will have to wait 15 to 20 years before actually starting any kind of services, specialist services or treatments. Can the Secretary of State reassure trans people across this country, both young and older, that we are committed to making sure that they get this health services that they need as quickly as possible?
I can certainly give my honourable friend that assurance that we want all trans people, in fact all people in our country, to receive timely access to safe and effective healthcare. We want to improve services for trans people specifically because we recognise the extent to which they have been let down. I just want to emphasise again that, that those young people who have been in receipt of puberty blockers with a valid prescription for these medicines for the 6 months prior to 3rd of June and 27th of August respectively can seek continuation of their prescriptions. I think there are risks that would be associated with interruption of those prescriptions, which is why we've taken that approach. And I know I can speak for the government as a whole in saying that whether it's access to healthcare, in my case, access to a whole wide range of public services and indeed safety on our streets. This is a government that is committed to improving the lives of trans people so they can live with the freedom, dignity and respect that any of us in our country would expect for ourselves.
Jim Shannon.
Madam Deputy Speaker, and can I very much welcome the Secretary of State's statement today. And it is never easy, Madam Deputy Speaker, to deliver a policy decision which the Right Honourable Gentleman has done today that has so much effect upon people. So I admire the Secretary of State and I wish to put it on record for his diligence and for his courage today in this statement. Secretary of State will be aware of the findings of the CAS report, which found that the change in practice from psychological and social support to drugs based on no good evidence, and indeed in light of medical professionals highlighting that puberty blockers by definition disrupt a crucial natural phase of human development. Does the Secretary of State not believe that we must extend the ban from temporary to permanent, not only to protect our children, but to prioritise mental health and the support that they so desperately need? Thank you so much.
I'm grateful to the honourable gentleman for what he said. These issues do weigh heavily on my conscience, and I, in relation to what he says about the safety and efficacy of puberty blockers, the simple fact is, Madam Deputy Speaker, we just don't know enough. And that's why building the evidence base and research is important. I want to make sure that young people with gender incongruence and dysphoria are receiving the best quality healthcare to improve their safety and welfare and well-being as children, but also to make sure they live long, healthy and happy lives as adults too. That's the basis upon which we're taking decisions and the care and sensitivity with which we are approaching this issue, as I know my counterpart in Northern Ireland is too.
Rachel Taylor.
Thank you, Madam Deputy Speaker. I know that today will be a difficult day for trans young people, not because of the Health Secretary's statement, but because of how our media might choose to portray what has been announced in the House today. I welcome the statement as well from the Shadow Minister, and I hope that we can take things forward together. I know that one of my constituents will be upset, but will reflect with his mum, who has been supporting him. He was referred by his GP when he was in Year 8 for gender dysphoria. He has still not been seen by a specialist, and he's now in his first year doing his A-levels. He's had to endure going through periods, suffering at school with the embarrassment of that. He decided to stop eating and was then diagnosed with anorexia because that was the only way that he felt that he could stop his periods and stop his breasts growing. These are the kinds of things that trans young people go through day in, day out. 3.5 years later, it's not good enough that he has still not been seen by a medical professional. And he is in the West Midlands, one of the areas where we're not yet announcing specialist services are going to be extended. I welcome the gravity with which the Secretary of State has dealt with this matter, and in particular he has responded to me when I've asked him to meet trans young people, which he's done. I would hope that we can move forward together and improve the mental health of all of our young people and take this issue seriously and work together rather than make this into a culture war.
Secretary of State.
My honourable friend demonstrates powerfully why the length of waits that she described in that particular case are simply unacceptable and unjustifiable. And she also details the real pain that is being experienced by young people who are not being seen by the NHS and not receiving the care and support they need. And that's why I'm determined to improve waiting times and improve quality of care. It's also why I think those of us in positions of influence or power, or those of us who have access to the microphone or the pulpit, need to think very carefully about the way in which we talk about this particular group of children, young people and trans people more generally, why headline writers and editors in our media have a responsibility to think carefully about how they exercise their freedoms in the media, freedoms which I strongly support, incidentally, but how they exercise those freedoms responsibly, and create a culture where we are not adding to the harms of this particular group of children and young people for the exact reasons she describes with that utterly heartbreaking case.
Sir John Hayes.
Thank you, Madam Deputy Speaker. I associate myself with the remarks from my honourable friend from Beaconsfield about both the tone and content of the Secretary of State's remarks today. I first raised my concerns about the Tavistock Clinic back in 2019 when a number of professionals there resigned because they were so concerned about what was happening in respect to prescribing. And the Secretary of State will know that anyone who raised those issues, and I think of Kathleen Stock, for example, has been treated very poorly, with spite, by some of the militant activists in this field. So whilst I entirely recognise the tone that he's adopted, I know he's a thoughtful and sensitive man, I do have to ask him this. You know, he's been very clear that prescribing practice was inappropriate. People weren't given time to give their full and informed consent. It was an unacceptable safety risk. So who oversaw that? When were those decisions made? Who made them? And how will they be held to account? For many young lives have been severely damaged.
Madam Deputy Speaker, I think there are, as the report into the failures of the Tavistock Clinic show, a whole range of individuals and organisations that did not discharge their duty of care appropriately to an extremely vulnerable group of children and young people. And actually, I want to pay tribute to the whistleblowers of the Tavistock and Portman, who laid their careers on the line, who were subjected to the worst kinds of attempts to silence whistleblowers, in some cases to bully them out of the organisation, to vilify them. That was, I think, not only a disgraceful way to treat good colleagues raising concerns, legitimate concerns, in the right way. It has actually, ironically, given that many of the people behaving in that way, I've no doubt did so with the best of intentions towards this vulnerable group of children and young people, they actually set back the national conversation for this group of children and young people and undermined confidence in gender identity services, and that cannot be a good thing. I also want to pay tribute to journalists that were willing to report on this. Pay particular tribute to Hannah Barnes, whose Newsnight investigation, I think, took some of these issues to a wider audience, and whose journalism, both on broadcast media and in print, shows how you can expose failure in a way and also expose the risks to a wide range of children, young people and adults in a really thoughtful, evidence-based way. Finally, he talks about the treatment of other people who've raised concerns in a wide range of contexts in this debate. He mentions Kathleen Stock. There are others too. I don't think that has been helpful. In fact, I think it has been actively harmful to having the kind of national conversation we should more broadly about gender identity. The way in which some women fear their sex-based rights are at risk. If we were able to navigate those issues in a much more thoughtful, considered way and listen to different perspectives and different experiences, I feel actually, despite all the challenges, really confident that as a society we could find a way through that maybe not everyone loves, but everyone can live with. We've done this before on same-sex marriage, for example, on sexual orientation and religious freedoms. It is possible if we're willing to listen, if we're willing to engage in good faith, and not shout down people who are raising heartfelt concerns. And maybe if we engaged in the conversation in a much better way, we'd find a better way through as a country.
Vicky Slade.
Thank you, Madam Deputy Speaker. Whilst I am deeply disappointed on behalf of our trans children for the statement you've made, I would like to thank you for speaking directly to those children. I know they will appreciate the sentiment that you've done for them. Trans young people in Mid Dorset and North Poole already rely increasingly heavily on their GPs, their schools and on CAMS, with many leaving education entirely, doing serious harms to themselves and losing their lives while on the waiting list. The former director of Tavistock told me that there was no data collected on incidents of assisted suicide and deaths of children that were on the waiting list, only of children and young people who had already started treatment. As a result of that, we have no information about the harms that young people and their families are going through in those years leading up to treatment. What assurance can the Secretary of State give me that those already under the care of CAMS and paediatricians will be treated urgently, and give me progress on how long those already on the list might expect to wait, and that he'll commit to collecting data from families on the waiting list so we can truly understand their experience?
Secretary of State.
I'm grateful to the honourable member. She's just pointing back to the waiting times, or the waiting list, I should say, again. There are 6,237 people currently on the waiting list. I don't think it is too much to expect the NHS to have a relationship with each of those young people on the waiting list, and to make sure that while they are waiting, that they are receiving some support and care. I've been given assurances that support is offered to young people on the waiting list. I continue to monitor that like a hawk. I'm grateful to representations I receive from across the House through honourable and right honourable members' casework, and I'm happy to pick up individual cases. Just in terms of the most catastrophic failures of children and young people, just to reassure all honourable and right honourable members, in the case suicide has been mentioned, all child deaths, whatever the circumstances, undergo a multi-agency review by a child death overview panel, and that information is reported to the National Child Mortality Database, and there is a monthly exercise by NHS officials to check the waiting list against NHS records. So we do monitor this very closely, and the mental health and well-being of this particular cohort of children and young people is both very close to my heart and very close to my gaze.
Jim Allister.
Thank you, Madam Deputy Speaker. I certainly welcome the Secretary of State's extension of the ban on the prescription puberty blockers. I want to ask him, though, has he more information for us on the criteria which will apply for entry into the clinical trials? Will there, for example, be a minimum age? Will there be parental consent required? Because both those things seem to me to be very important. Can I have assurance on those 2 points?
State.
I'm very grateful to the honourable member for for his questions. The details of the trial are still being worked through. They will be subject and are subject to a robust ethical approvals process. And only once final ethical approval is granted is the final study design set in stone. As such, I can't comment on the finer details at this time, but just to reassure the honourable member that the issues that he raises are very much under consideration in relation to the design of the trial.
Carla Denyer.
Thank you, Madam Deputy Speaker. I share the concerns expressed by experts at the Council of Europe that removing access to puberty blockers except through clinical trials may breach the fundamental ethical principles governing research, amounting to coercion and therefore a breach of young people's human rights. Exactly how harmful this decision is, however, hinges on how easy or hard it is to get on the clinical trial. So, can the Minister tell me how many places there will be on the trial? And if he cannot at this current stage, please can he reassure me that he will take very careful consideration of the fact that if the trial is limited in size, this will cause harm to more trans and gender questioning young people?
Secretary
I'm grateful to the honourable member for her question. The trial will be uncapped, and just to reassure her and the House, all NIHR commissioned research must go through robust scientific and ethical approval processes, both of which can influence final study design. So we are absolutely, in terms of the design of this trial, have ethics as an integral part of the approval of the trial.
And the final question, Robin Swan.
Thank you very much, Madam Deputy Speaker, and can I thank and welcome the Secretary of State for his statement in regards to both the tone and the approach that he's taken, and I do welcome that this indefinite ban will also include Northern Ireland, and can I thank the Secretary of State and his predecessor for that collaborative approach they've taken with the Minister of Health in Northern Ireland. But also, Madam Deputy Speaker, I think it's important for the House to note that the ban in Northern Ireland was supported by all the Northern Ireland executive parties as well. But can I ask the Secretary of State, in a statement he talks about being able to restrict the supply of puberty blockers through a prescription issued by a prescriber registered outside the United Kingdom, can I ask him what steps he will take to close all those loopholes and avenues would actually allow these drugs to either be prescribed, recommended or supplied by online suppliers for under 18s?
I'm grateful to the honourable member for his question. This is a challenge not just in relation to these drugs, but more generally as well, and it's something that that we are looking very closely at. More broadly, I want to just acknowledge the first part of his question as well. I'm very grateful not just to my counterpart, Mike Nesbitt, in the Northern Ireland Executive, but to the First Minister, the Deputy First Minister, and all parties involved in the Northern Ireland Executive for the collaborative way and the spirit with which they have engaged in discussion about this issue for Northern Ireland, and also their willingness to work in partnership with the UK Government. I think that's to their credit and to the benefit of all citizens across every part of the United Kingdom.
That concludes the statement.